Thank you for that introduction and welcome all. Good morning, good evening, good afternoon. Thank you for joining at this late hour for many of you. Okay, so I think the introductions serve to share some of the items that we will cover. I want to start by just doing a quick overview of OpenHIE, which I think many of you, if not all of you, are familiar with. And then I want to talk about a little bit about the origin of the OpenHIE Academy, some material that we have and how do you access it. And then I would like to talk a little bit about where we think we'll go next and get your feedback on that. So I wanted to start with just the mission of OpenHIE. And I underlined some things in the mission and vision that we have. And I underlined those because I think that as we talk about the Academy and other capacity building materials, you'll see that actually much of OpenHIE is focused on helping health leaders and advisors, as well as implementers and technologists. And we see ourselves as being a global resource for supporting health information exchange. And so what we're going to talk about today is how we think OpenHIE does that. Just to kind of give you a little bit of a compass for thinking about OpenHIE, I want to point up here in the top corner of this slide, OpenHIE is a community approach, and we won't be talking very much about how to engage in the community. We'll be talking a little bit more about the artifacts, but I did want to recognize that everything we do is based on a community approach, and we're supporting health information needs. And those can be needs that are supporting patient care, population health, as well as healthcare administration. And I'll just give a quick example of healthcare administration. As we went through the pandemic, there were cases where health information exchange information was used to plan where facilities were and where health workers were and how they could support the pandemic efforts. And obviously, you know, information about supplies and coverage. And so you can see that really the pandemic probably covered all three of these health information needs in case surveillance and case reporting, as well as providing for care for patients. And so OpenHIE focuses on doing that through providing architected capabilities. And I've listed some examples there. And we do that by documenting what is the OpenHIE architecture and how do the pieces of information flow through the architecture. I often get questions about standards, and I have used this picture to help describe how OpenHIE fits within the standards. So we could think of OpenHIE as defining an architecture on top of things like IHE profiles and fire implementation guides, which are built on the foundations of HL7 and fire. So I just kind of wanted to give this picture of how does OpenHIE fit in with the standards. And I'm not going to go into this in detail, but I just wanted to provide an example of architected data exchange standards. You can find this in the specification, which we'll talk about a little bit more, but these are examples of the profiles that OpenHIE is built on top of. So what we're going to spend a little bit of time talking about is these key artifacts. And the first one we'll talk about is the OpenHIE architecture specification, which I've already alluded to a little bit. The second one is the Getting Started Guide, which is how might you get started with OpenHIE or Health Information Exchange. And then the third is the Academy, which we'll spend a little bit more time on. So just an overview of the architecture specification. In the last few years, we have tried to make this a little bit more robust. It initially grew from wiki pages where there were sketches of how information flowed between the architecture components. To make it a little bit easier to use and a little bit more formalized, we have recently worked on having an architecture specification document, which includes versioning, and specifies what the changes are from one version to the next. And it is in a format that should allow you to flip through the information and find what you're looking for. You can also use the search feature. There are basically 3 levels of information that are contained in the specification. The first is the architecture diagram, which really talks about what are those components we need to support a health information exchange. Many of you are familiar with these: the client registry, the facility registry, a terminology service. I'm sorry, my mouse keeps making me jump here. Apologize for that. The second component of the architecture specification is really a description of those architecture components. So for example, for the client registry, we specify what are some of the key components that you should look for in a client registry. One of those, an example, might be that you need to make sure that if you're looking for a client registry, that the client registry supports a way to configure patient matching. And so this part of the specification can be used as you're looking for different software to support different needs in your health information exchange. We're outlining what are some of those requirements that you should consider as you're looking at the different types of components and how and different software that you can use to meet those components' needs. The third thing that the specification really covers is what we call workflows, which is really an outline of how the data moves between the components. And it specifies how those standards are used to share data between those different components. So that's an overview of the architecture specification. One thing I want to make sure that I cover is this left side of the diagram. And how do we create this architecture specification? This specification is really created through a community process. So we receive input from the community, and ideally, the community is making sure that they are engaging those on the ground and those who are actually implementing, as we decide, you know, what are the missing pieces to the specification, what can we add in next, and where should we go. So for example, we're getting ready to do a new release in the next couple of months, and that will include information that's more that has health information exchanges for how to share maybe some of the financial information on billing for a patient, or seeing if a patient is covered by a particular healthcare scheme. So those data exchanges will be documented in the next version because that was requested by the community to be something that we add. And it was, and that documentation is based on real world experiences of those workflows. And then we mark them at a certain maturity level and hope that as time goes by, we would get feedback and input from other implementations and be able to mature and harden those best practices or patterns that we're seeing in the field. The next artifact that I want to talk about is rather new. It's called the Getting Started Guide. And this is based on the experience that we've had for the last several years. We've noted that there are 3 ways that implementers tend to get started when using OpenHIE. Some implementers want to start with the component. For example, the facility registry is one component that people often start with. Others want to start with a data exchange project where there's a particular problem. I think of Mom Connect, or maybe a project like that where there's a need to share data and that need is articulated, and there are multiple components that are needed to bring that data exchange use case to life. A third part, which I think many of you in AeHIN are using, is an architected approach, where you start with an architecture project. I think one thing that's important to note is that the data exchange project is where you begin to see the value and see the value of health information exchange come to life and showcased. But all three of these are important to actually become successful in being able to share data. There's just three different places to start, and we've seen these come to life in many situations. So the Getting Started Guide just helps outline what these paths are and provide some direction and examples. We would love input and any thoughts you have on how to make this better. And then in this guide, you'll also find some references that can be used as you're along your journey. So I'm going to move now to talk a little bit about the OpenHIE Academy. The origin of the OpenHIE Academy really comes from the OpenHIE meeting that we had in Addis at the Tanzania meeting, which I believe was in 2018. We had several people who were brand new to OpenHIE, and there was feedback at that Tanzania meeting that it would be great if there was a way to make sure that before the conference started, people had similar language and understanding that allowed them to participate more fully in the conference. So at the Addis conference, I think EnterHealth and some others took the lead in preparing a workshop that happened, or a training session that happened before the OpenHIE meeting started. And basically there were a series of presentations with some hands-on activities that were smaller, that allowed everyone to begin to get the same type of language about health information exchange and be on the same page of what do we mean when we're talking about health information exchange, and how would we get started. So after the Ethiopia meeting, we had some good feedback, and we were working toward, okay, what are we going to do the next year? And then that's when the pandemic hit. And we realized that we needed to do something that was not just based in person. And actually the value of working online or electronically allowed us the potential to reach more people and reach them, you know, across time and space. And that was really valuable learning. So our first Academy courses were basically some of those presentations that were given in Addis, and they were recorded. Since the launch in January 2021, you see that we've now been able to have over 500 people that have logged into the Academy. And we are also evolving our content, and I'll talk about that in a minute. Oops. So this is just a little bit about the types of content we have available in the OpenHIE Academy. There are three main types of content. The first is we've started with some of those HIE courses that were offered in Addis, and we built onto that. And I'll highlight the facility management, the terminology courses, which are new, in a moment. So we kind of have these courses that are a core set of foundational information about what is health information exchange and what might be an architected and standards-based approach to health information exchange. We also know that there's lots of good things going on in the broader OpenHIE and health information exchange community. And when we see those courses out there that are self-paced and available, we have tried to link to those so that anyone who's logging into the OpenHIE Academy is aware of other opportunities to learn more. Most of these courses that we have right here tend to be a little bit more technical in nature, but we think they're important to the audience that we're pulling. The third thing, which is also very new, is an OpenHIE Foundation certification. And I will expound a little bit on this as well. So let's just talk about these three new things a little bit more. We are also working on additional terminology course material that will be hopefully released in the next couple of months. And we're also working on a client registry course that will hopefully be released in the next couple of months. But here are the three things that we have as the newest material that's available in the Academy. The first one is this terminology course, and it really digs deeper into the importance of terminology, shares what some of the health terminologies are, and allows users to better understand that need for semantic terminology and how it supports health information exchange. The next course about terminology, the one that's in the works right now, we're beginning to move into how would one get started in using health information terminology and what might you do. So that's the course that obviously is taking us a little bit longer to add those modules in, but you'll see more about terminology coming. The other course that is newly released is this facility management course, which again talks about what to think about as you begin to stand up a facility management tool or process, and how might you implement that. So I'll also talk a little bit about this foundations certification. You'll notice that our courses are listed as free. So we really want the material that we're creating with the OpenHIE Academy to be accessible and available for anyone who wants to have that foundation of what is health information exchange and what is an architected and standards-based approach. So we offer that for free. However, we do know that there is a desire for people to be able to note what types of learning and what types of skills and information that they have. And so this new thing that we've offered, and I believe there's going to be a partnership with AeHIN on that, is a certification. So the foundation certification really helps say that a person has a foundational understanding of health information exchange, the components needed to support that, and a standards-based approach. It's currently $39 US to take that test, and the test is based upon some of that free information that's available. We have a certification page that is available on the OpenHIE Academy site that really explains what information you would need to understand and how to use the OpenHIE courses to get that base information to take the certification. I want to also mention that OpenHIE has been partnering with AeHIN to create a way to do some more certifying in AeHIN. So I'm sure many of you will hear more about that, and maybe we'll be ready to share that in the next few weeks. And then I also want to share further in the presentation the thinking that we're doing about how do you build upon this foundation certification, and how do you actually get maybe some actual experience and then get recognition that you have that experience. So that's where I think we're going to go next, and I will talk about that a little bit later. So after our first year of having some of these capacity building and training materials, we decided that we really needed input and feedback to be able to move forward. And so what we did is we took information that we had received from doing a live version of some of the classes in the fall. We also, at OHIE 21, we also had a session that focused specifically on the Academy and capacity building. And then here in the last month, we've hosted 3 different capacity building learning sessions where we got input from different people in the community who saw our call out to provide input and feedback. And then from those sessions, we really thought about like, who needs to be trained? What are the knowledge and skills that are needed? And how can OpenHIE make an impact or help there? What we heard from you all as we gathered that input and feedback is that there are many different actors, and those actors have many different needs. And so as we thought about these different actors, administrators, architects, project teams, system users, and even students who might someday fill roles in the ministry and implementation organizations and or in hospitals, we thought about like what those needs are and gathered that from the community as well. And so here's a little bit of the feedback that we got from the community about what is needed to stand up health information exchange and support it. And you'll see based on that audience or number of people or users that I showed on the last slide, there's quite a bit of things that are needed, quite a bit of learning and expertise that's needed. And so as we looked at these, we thought about what could OpenHIE initially focus on. And we also thought about what are other organizations focusing on. For example, I see a lot of things coming from maybe like USAID and WHO on data governance and leadership type of skills. And so we thought that what OpenHIE could focus on is maybe some of these foundational concepts, making sure that we're creating a pathway for developers to develop their skills, and architecture topics. We also did an assessment then of, okay, based on what the community thinks is needed in the field, where is OpenHIE and OpenHIE Academy contributing right now? And we kind of did this little assessment of a check mark of, you know, are we already covering that? Or maybe this little arrow, we're covering that, but we want to do it a little bit more deeply. And then this box, we know we need to cover that and we need to move forward with that. So you can kind of see how we're trying to assess ourselves and figure out where to move forward. So our tactic would be that we're really thinking about these areas that I've starred. Other things that came forward in the sessions where we were listening is that French and Spanish are needed, especially for areas where English is not used. We realize that, especially in this audience, there are probably many other languages that are needed. But what we were hearing most loudly and clearly is that French and Spanish are the first places that we really need to focus more. We also were hearing that there are things that OpenHIE could do right now. And one of them is develop a ladder for technologists. the comment and the feedback that we received is there are many people out there who have maybe 5 years or less experience and need more practical hands-on experience and opportunities to advance. So you'll see kind of how we're trying to formulate solving that problem in a minute. The other thing that we heard is that OpenHIE is really good at awareness and providing access to information and tools, and that what would be desired is to have a directory of tools and a directory of technical assistance. So based on kind of what we were hearing, what we decided to do was think about what would be our strategic approach. And as we were thinking about our strategy, I think what we want to do is continue to partner with other projects and initiatives to build that more holistic picture. So OpenHIE, we don't view ourselves as providing the whole picture of the training that's needed, but we would like to make sure that we're linking and partnering with others who are working in that space. As we are designing training or solutions, we want to make sure that we're keeping language in mind. And what I mean by this is our original academy materials were very video based. And as we thought about translation, we realized that that's not the most conducive to being able to translate and share in other languages. And so our new materials are focusing more on translation friendly ways of sharing information and ways of sharing information which are more, I think, human centered and more created with the learner in mind. And then we want to focus on these OpenHIE strengths, which we think are foundations of health information exchange, providing practical experience and knowledge sharing. So regarding building a pathway for technologists, we already have this Academy Foundation certificate. And what we're envisioning is that we need to do something that's more about helping people get experience. And so we have some ideas that were gained from those listening sessions. And we imagine that there could be a way to offer, as a community, maybe a board where experiences are available and students and or new graduates or those who are people practicing in the field who are just looking for an experience could go to find and match up with an experience. We're also thinking about, much like you could get a project management certification where you're logging certain number of hours or a certain number of projects that have been completed, and what maybe a certified implementer might look like. So those are things that we're building toward the future based on the foundations of this self-paced learning that's currently available. Oops. We also imagine that we could make an impact in more of this ability to share information. And so I mentioned maybe there's this directory of available experiences that it would allow people to get hands-on experience. We already have kind of a list of software, but we don't do a very good job of making sure that there's demos and that there's some type of assessment of what functionality that software does and or some testing that proves that a piece of software can support the data exchange needed. So we imagine this is an area where we could grow from a list to be more comprehensive and provide a little bit more information about what each tool can do. There's also this request for this technical assistance directory. And we imagine that we could move toward having some type of list and also some way to showcase the types of impact that some of those implementers are making. So these are some of the ways that we're imagining the future. So thank you so much for this opportunity to share a little bit about where we've been and where we are going. I would love if we could use the chat and or I don't know, I can't remember if there's a Q&A box or not, but I would love it if we could use those to maybe get some input from you all about these are some discussion questions I just thought maybe I'd put on the table. Um, does this align with your needs? Are there other needs that we Open HIE should be focused on and considering? Maybe there are additional materials that you're aware of that Open HIE could link to or showcase in our academy. And maybe there are teams or universities or people who would really like to partner with us on this journey of building courses and or those hands-on experience. So I would love to be able to get your input on these types of things. And I'm gonna move out of present mode so that I can better see the chat box and participants and see if we can respond.
Yes, thank you for sharing your work with us in OpenHIE, Miss Jennifer, also for the courses that can be explored by the AN community. Also, we have useful links entered here in the chat box. So we'll be sending these as well after the webinar. If you have questions or other insights that you would like to share with our colleagues in Open HIE, please feel free to use your mic or raise your hand so we can enable them. I think Dr. Alvin is raising his hand.
Thank you, Jennifer, for letting us know more about OpenHIE. OpenHIE has been an AeHIN partner as far back as I remember. I remember when Paul and Sean and Derek were in Manila in 2013. And we were able to get an emergency audience with the Minister of Health back then. And, at that time until today, OpenHIE had the most robust framework for interoperability that I know, at least for healthcare. And and we're happy to host OpenHIE again this October when we have our general meeting, October 10 to 13. So just to register that to you, Jennifer, that there those dates that in case the OpenHIE team is available, we can hold another pre-conference or even the main conference session. Having said that, I think I'd like to sign up for number 4 for the University of the Philippines, Manila. I appreciate the academy, the OHIE Academy. I've started taking the courses myself. And once I finish my certification, I would then offer it to my own students in my master's class. I think the important component after the the classes on the academy is actually the hands-on exercises and practical projects that they can do with their hands. So, and that would then, segue to a laboratory type of project for the students, an interoperability lab project, where we can start offering the students to the ministry and, like ask the ministry, are there any projects you want converted into an interoperability demonstration? And then the students can then work through the content of the academy, and their output would then be presented at the end of the semester or at the end of the year to the Ministry of Health. So I think the students are also waiting for projects. The masters in health informatics, most of the masters in health informatics projects are like electronic medical records or systems that they want to build, but mostly just inside one facility and not interoperating with the other projects. I think the next generation of informaticians would be working on interoperability and governance and the socio-technical aspects of interoperability. So sign me. I'm signing up for number 4, and I'd like to know if there's interest from OpenHIE to get a slot at the general meeting this October, Jennifer. Over.
Yes, Alvin, thank you so much for that opportunity. We would be happy to do that. And I think Jamie came to your meeting last week. So yeah, we look forward. We'll definitely partner with you and hear more about it and figure out how we can help.
Thank you.
Yes, thank you, Dr. Alvin and Miss Jennifer. I think Dr. Uday is raising his hand. Doctor, I think you can enable your mic.
Yeah, I have just one query, because when I see the pathway, it starts from foundation, go up to implementation. But the second part, which we call architecture certification, which goes up to planning part, and then the different vendors based on RFP will be invited to submit, or we will suggest any tool which is coming on. So what is the time frame when somebody can raise a certification like, okay, this guy is OpenHIE architect certified. So is there
Yeah,
any horizon? That's what I wanted to know.
yeah, thank you for that question. So you know, I think when we talk about architecture for OpenHIE, we're really talking about understanding those different components and how those components work together. And so some of that Academy Foundation certificate, which is really for any type of person, covers, you know, what are standards, what are the components that we recommend having in a health information exchange. I don't think, you know, Uday, I think you come from that more rigorous TOGAF type world. I don't think OpenHIE sees us as, you know, certifying someone as an architect. I think we see ourselves thinking about more what is that architecture and being more practical. But I would be willing to work with you and discuss how we might think about that and partner on that. I think AeHIN has probably done a lot more work in that area than other areas of the world. So I would love to hear more from you about your thoughts about how we might be able to do that.
Yeah, thank you for your answer. I don't think that today there is any time for that. Probably as per your convenience, we can schedule a time and then we will discuss on this particular subject. Thank you.
You're welcome.
Thank you, Uday. Okay. Jennifer, Uday, I think there's value in I think UTOGA, from my perspective, because I'm both an OpenHIE advocate and a TOGAF certified. I think there's value in complementation of the TOGAF methodology and the OpenHIE open community. We just need to like come together and think about how these things plug in together. So I'd be happy to participate and convene that meeting between OpenHIE and TOGAF and anyone else you might think might be a good stakeholder in that process. I hope we can present something about these discussions in October. Thank you, Jennifer.
Yeah, that sounds great. And Uday, thank you for bringing that forward. I think that's definitely needed. And I think we had talked about in the past, maybe outlining what types of roles we see a Ministry of Health needing. And maybe one of those is an architecture role, and being able to even outline what that person would do might be an important place to start. I'm also seeing questions from Vladimir or comments. Vladimir, do you want to bring those forward?
Hi, Jennifer. Hi, Alvin. Can you hear me?
Yes.
Great. Yeah, so thank you very much for updating us. It's very exciting to see what OpenHIE has been working on and the plans for the future. So my first question is really, with this proliferation of certifications, it would be great to have, as you sort of alluded to earlier, a bird's eye view framework of everything that is really under the sun, so that people can really select which paths and which certifications they can follow, right? So I guess, it's not just the OpenHIE or the future AeHIN certifications, but, this digital health leadership program that has been floating around for the past couple of years, and working on WHO's digital health capacity building initiatives, and then of course TOGAF, HL7, IHE also has a new certification, HL7 and Fire, SNOMED, etc. So it would be nice to see one sort of harmonized framework incorporating all of this, especially since you are catering for different pathways, right? Like architects, developers, implementers, project managers, etc. And then my second question is, there is a digital health capacity strengthening SWG meeting on Tuesday. I don't know if you're already involved or plan to present there, because that would be really relevant to the scope of that SWG. So thank you.
Yeah, thank you for that feedback. So I have asked Derek if I could have his slide that talks about all the different components that they're thinking about in their framework. And I have had some conversations in that digital health capacity building meeting that you're talking about, where I think OpenHIE is trying to focus in right now on some of this HIE stuff as well as developer things, while we know that others like specifically Merrick and others are working more on the health leadership and governance types of tracks. And so in some ways we are meeting, and through that digital health capacity strengthening working group, having conversations and knowing what each other is working on and trying to coordinate it. But I agree that it could be a lot stronger. So I think that we will definitely need to be clear about where OpenHIE is playing in that framework and the types of things that we would like to do. But I hope you noticed in our strategy that we really think that there's a lot of strengthening to do, and that we will try to play to our strengths and partner with others, including Derek and Merrick and others, to make sure that we're moving things forward as a group.
I guess you hit two birds with one stone. So, but I was wondering if Alvin has any comments on the upcoming AeHIN certification as well.
But thanks for asking, Vladimir, and good to see you here. So we've had a lot of discussions at the AeHIN leadership about certification, and we haven't really thought about creating a certification around the AeHIN brand, because as a matter of fact, we do not have a certification or training program. What we do is we identify experts and entities who offer expert training programs and certifications after those training programs, and then we attest to them, and we take them ourselves, and then we embed this this new knowledge and certificates into the work that we do in our own country. So I'm still not convinced internally that we should create an AeHIN certification, but we do want to create a network or an ecosystem of trusted AeHIN partners that we know have very good materials and very good attestation programs that we can now tell governments and ministries, for this person in your ministry, we think he's better off with TOGAF, and this person in your ministry should know more about OpenHIE. And that's just a recommendation. You might want to ask them to take something else. But about AeHIN certification, I'm not really keen on doing that. I'd rather have the experts do that for us, and AeHIN will then be the one promoting or advocating with the ministries that these programs actually exist. Thank you, Vladimir. Cha, I think there are more questions. Oh, yeah, go ahead, Cha.
I think the next question is also from you, Dr. Alvin.
The
Regarding
comment about GovStack.
yes.
Yeah, so Alvin, thank you for that. The question is about GovStack and how OpenHIE is intersecting. I think I saw Paul on the line, so I don't know if Paul wants to jump in. But there are definitely OpenHIE folks who are engaging a bit. Paul, would you like to address that?
Well, first off, I just wanted to say I really appreciate the opportunity to see some familiar faces and to hear some familiar voices. Vladimir, I think it's been a very long time since we've talked, and I see a number of others, friends here as well. I just maybe wanted just to briefly say that in my experience, there is an important set of trade-offs between being a meta architecture to support all architectures and being pragmatic and being supportive of countries where they're at. And so when it comes to GovStack, what I can say is that we regular conversations with the leaders of that important initiative, but we do not want to lose the focus around health that we all are being consistently asked to support. So there are real world health needs. Countries are asking for immediate support around information sharing. We want to simultaneously support those more immediate needs and learn from the experiences of countries while trying to understand how our work interrelates with something like a GovStack. And so what the GovStack leadership has told us repeatedly is that OpenHIE is a very heavy influence on the way that they're conceiving their entire initiative. And we have very good cordial relations. And so I think there's a bi-directional learning that's occurring, but I just want to make sure to commit to those that are trying to benefit from OpenHIE that our focus continues to remain on being pragmatic. And so I don't know how else to answer it other than that. Hope that helps.
Thanks, Paul. Actually, because we only have 5 minutes to go, I just wanted to give an invitation to there are faculty in the call right now, Paul, and I would like to invite them to form a cohort. Of course, on one side, I already mentioned that UP Manila would be willing to set and put up a cohort of students and embed the academy into our master's program. I see Professor Anis Fuad from University of Gadjah Mada, Arturo Onqueco from UP Manila, Chris Sieberts from Cape Town, Sue An Lee from National Taiwan University. I hope I'm not missing anyone here. Tofik, I know, is from Indonesia, and Dr. Thep is from the Ministry of Health, Laos. I don't know, Vladimir, is if you also have an academic position. But if any of you are interested, after the call, we can have an email exchange. If you want to put up a cohort, we can put up a cohort between now and October. And hopefully by October at the GM, we could say something about what we learned about taking the Academy, OHIE Academy together. Paul, I hope you can support us on that.
I mean, more about this, but all I can say is that we are.
Do we have more questions?
Hi. So I think we can announce the OpenHIE certificate program, Dr. Alvin. Yes. So actually, I'm Priya Saichun. I'm AeHIN Secretariat based in Thailand. So we have like 3 minutes left. So AeHIN now offering an OpenHIE certificate program. So we are right now releasing this call for the applicants to OpenHIE Academy's Foundation in Health Information Exchange certification exam. So we will support individuals on the course of taking the OpenHIE certification exam, which is $39 US. So next. Yes, so those who are AeHIN member are eligible for the program. So next, Sha. So for the mechanics, so I leave the application link in the chat box. So the eligible applicants must fill in their application form through the link before May 31st, 5 p.m. Manila time. So application will be reviewed by the AeHIN Governing Committee and AeHIN Working Councils. So they will be notified of their status via emails. And for those selected applicants, the links and instructions regarding the login process will be sent via emails. So if there are any questions, you can contact me via email, secretariat.thailand@aehin.net. So yes, so please join the program. So we are releasing the program right now. So thank you, Sha.
Yes, thank you, Lukwa, and also thank you to Miss Jennifer for sharing their work. I think Dr. Paul would like to say something.
Can you all hear me okay?
Yes, Dr. Paul.
Yeah, I didn't really want to say much other than to say to Alvin that, Jennifer can say a lot more about this, but I think it's always been our vision that the Academy is not something that is led and born by people from the US or Europe, or we want the Academy, to the extent that countries are ready, to own and help drive the agenda in collaboration with each other. And Jennifer and myself, while we have some domain knowledge around health and health information systems, we feel like ultimately the role of the community is to be something that is owned by the beneficiaries. And so to the extent that partnerships like the ones that you were alluding to, Alvin, can be manifest, we would love to find ways to make those partnerships occur. Jennifer can say more about this, but she spent a considerable amount of time building the content that exists somewhat in partnership with universities in Ethiopia and other universities that are ready to engage in this process. And I think I'm gonna let Jennifer speak, but my guess is that Jennifer would be absolutely delighted to expand that realm of partnerships to other universities throughout Southeast Asia. I don't know if you want to say anything more, Jennifer.
Yeah, thank you, Alvin, for answering the call out that I gave to partner. And I look forward, I know we're out of time, so I look forward to seeing how we can partner and what we can build together. So I look forward to that next conversation.
Thank you, Jennifer. Thank you, Paul. Good night, everyone. See you at the Academy. Thank you.
Thank you.